Hello everyone, welcome you all in this video tutorial. So in this video lecture, we will discuss about the specific type of bacterial infection caused by several types of bacteria and which is named as bacterial vaginosis. So let's start with the introductive part. So before moving to the topic, let's understand about the bacteria. So basically the bacteria are microscopic, unicellular and single cell organisms. So which means that they are very smaller organisms that they cannot be seen by naked eyes and they need an electron microscope to see their structure. They are unicellular organisms which are made up by only a single cell, and they are prokaryotic organisms which do not have several cytoplasmic organelles and also they lack a well-defined nucleus in their structure. So basically these bacteria are of two types. The first one are pathogenic bacteria which cause different types of disease in higher animals including humans, and the another type are good bacteria which are also called as probiotics that are beneficial for humans. So they can cause several diseases in humans, and these diseases are called as bacterial diseases and as bacterial infections. So the bacterial infections are defined as some bacterial species which cause harmful diseases in humans, and these diseases are called as bacterial infections. And these infections include several examples like bacterial meningitis, which can be caused by different types of bacteria, bacterial pneumonia, which is a type of lung-related disease, anthrax fever or typhoid caused by Salmonella typhi, or bacterial vaginosis. So in this video lecture, we will discuss about the bacterial infection called as bacterial vaginosis in detail. So let's start with the bacterial vaginosis and what is this? So basically the bacterial vaginosis is a type of bacterial infection which is caused by several types of bacteria. So it is a type of vaginal inflammation or a type of vaginal disease caused in the vagina of woman, and it caused by the overgrowth of bacteria. So basically in the human or in the vagina of females, there are several bacteria resides in the normal number and they are not harmful for us, but when due to some causes their number increases in the vaginal pathway, they causes several types of diseases, and this condition is called as bacterial vaginosis. So it is the most frequent vaginal disease in women of age from 15 to 44. So basically it is the most common and most frequent disease in the woman of reproductive age. And it is very common as only in India there are more than 1 crore cases per year of the bacterial vaginosis. So we can assume that how common this disease is. Now the percentage of women affected at a given time may vary from 5% to 70%. So that's why it is considered as most frequent vaginal disease or very common disease for the females. So now let's discuss about the symptoms of bacterial vaginosis. So as we have discussed that it is very common and very frequent vaginal disease, and in this disease there are about 50% of women which are asymptomatic. That means 50% of the patients suffering from the bacterial vaginosis didn't show any symptoms for this disease. But beside this, there are some common symptoms of this disease which include a grey or white discharge from the vagina, which is considered as vaginal discharge, and the another symptom is burning when the urination or a burning sensation in the vagina, or itching or fishy smelling or a foul smelling from the vagina, and this smell increases after the intercourse. So these are some symptoms for the bacterial vaginosis in the female. So now let's discuss about the causes and reasons for this disease. So basically, as we have discussed, that it is disease which caused due to the overgrowth of some good bacteria or some probiotics which are normally found in the vaginal tract of the woman. So basically these bacteria are very helpful or act as a probiotics in the vaginal tract of the woman, but due to some disturbances or some another reasons or factors, these natural number of microorganisms increases and this causes infections in the vaginal tract which are called as bacterial vaginosis, and it happens when certain kinds of bacteria which are present in greater amount than usual. So there are several risk factors or some factors which increases the risk for the bacterial vaginosis, and these risk factors include having multiple sex partners, which increases the risk for the bacterial vaginosis in the female, and douching also. So basically the douching is the process of cleaning or watering the vaginal tract with the help of several shampoo and soaps. So it didn't need because the vaginal is a self-cleaning organ. So douching also cause sometimes different types of infections in the vaginal tract. And in the vaginal tract there is a bacterium called as lactobacilli. It resides as a probiotic, and when it is leaks, so it also causes several types of infections due to leak of lactobacilli bacteria in the vaginal tract. So these are some risk factors which increases the risk for the bacterial vaginosis. Now the diagnosis can be done by different methods. So there are several methods to diagnose the bacterial vaginosis in the patient, and the first method includes medical history of the patient. So in this method the doctor may ask some questions about the medical history or having any vaginal infection or sexually transmitted disease, so that he can assume the probability of having these infections again. The another method is checking the pH of vagina. When a vaginal pH of 4.5 or higher is the sign of bacterial vaginosis, because we know that the normal pH of vagina is acidic, which prevents the bacterial infections. The third method include testing of vaginal discharge. So as we have discussed that in the case of vaginal infections there are white or greeny discharge. So with the help of these vaginal discharges it can be diagnosed about any type of infections. And the another method include overall physical exam. Now the question arises that how the bacterial vaginosis can be treated. So basically the treatment include use of different types of antibiotics, because it is a type of bacterial infections, so it can be treated by the help of different types of antibiotics like metronidazole, clindamycin, tinidazole and many other antibiotics which are used to treat bacterial infections. The another method of treatment is use of probiotics. We know that probiotics are a type of good bacteria which resides in our body. So the use of probiotics like lactobacillus and many other probiotics can be used to treat the vaginal infections. And the another method use antiseptics. So instead of use different methods of douching, there are several antiseptics can be used for the cleansing of vaginal tract that can help for the treatment of vaginal infections. Now the bacterial vaginosis can be prevented by different methods. So the prevention methods include use of probiotics in our diet. So there are different probiotics like lactobacillus which is found in curd, and there are different other probiotics which can be used in our diet to prevent bacterial infections and also bacterial vaginosis. And the another method of no douching, because douching causes harmful bacterial infections, so don't douch because the vaginal tract is self-cleansing organally. Now the third method include minimizing the vaginal irritation and get tested for sexually transmitted diseases so that it can be tested And the fourth method include use the methods to avoid sexually transmitted disease like condom and many other methods, so that different types of sexually transmitted diseases can be cured and can be prevented. So these are some methods of prevention of the bacterial vaginosis. So in this video we have discussed about the bacterial vaginosis, its causes, its symptoms and its methods of treatment. Thank you.